Well, welcome, Facebook viewers. My name is Brad Bodis, and I'm an attorney with the Bond & Bodis Law Offices. Bond & Bodis Law Offices are located throughout Alabama, through most of Mississippi, and we're in the Knoxville area in Tennessee. And we help people with money problems. And we know, with what we've all been through over the last year, that a lot of people are having financial challenges right now. So I just want to encourage folks, if you are having money problems, if you feel like you're going to be having money problems, please be proactive. Every one of our offices is offering absolutely free initial consultations with an attorney right now. Just call the number on your screen or go to our website. We have a little bit more information there, and you can request a free consultation. No pressure, but we'll absolutely be glad to talk to you about your situation and try to lay out some solutions for you if you're having problems. So today's Facebook Live, we are fortunate to have a return guest, my good friend, Dr. Larry Gazzini. Dr. Gazzini first joined us back on August 5th last year. It's been a while, and Dr. Gazzini, at that point, we were just talking about whether or not people should wear masks. We addressed some of the myths with masks that are out there. It was kind of in the early months of COVID. Now we are well along the path, and thankfully, we seem to be seeing some good signs right now. We have a vaccine, several vaccines that are available. In fact, one of your partners joined us for an episode when the vaccine first came out. But Dr. Gazzini, I want to thank you for joining us today. It's good to have you back.
Well, it's good to be back, Brad. Always good to be with you. There.
So, Dr. Gazzini, I know that you practice medicine here in Birmingham. You and I have known each other for a long time, both socially and, of course, I use your medical practice for my personal needs. But for our viewers, give us a little bit of your background, your educational background, and what your practice consists of today.
Okay. Yeah, internal medicine. So internal medicine is basically summed up by adult primary care. And so we see lots of hypertension, diabetes. We, see people for a lot of the sinus infections and bronchitises and those type things as well. But as far as background, originally from Montgomery, I went to undergrad at Auburn and Montgomery, and then from there to UAB School of Medicine, and then did my internal medicine residency. Got board certified, and I've been in practice, now since 1991, out of those, about 30 of the years here at internal medicine specialist over at Brookwood.
Well, you left out some important things, and I'll just tell our viewers, Larry's also just a great guy. He's a great father, husband, married to his wife, Debbie, for many years. They have 3 great kids, and you are, since our last episode, I believe, a grandfather now.
That's right. I've got actually, I guess he was around before then, but he's 17 months old. 17 months old.
The last year has been kind of a, I'm getting lost, but I don't think I mentioned the fact that you're also a great granddad and a great bowler. Larry bowled in college, and we still bowl together. So Larry, you talked about your long time in practice. We're going to talk today about what the future looks like. We've got a vaccine now. People are getting vaccinated. Millions of people have already received their vaccinations in our country. And we're going to talk about, hopefully, a brighter future, life after the vaccine. But to give our folks just a little bit more specific reference to your experience, I imagine this last year in your practice has been like no other year.
No, all too often people have tried to compare this to the flu, but if you ask somebody, well, who do you know that's ever died from flu? The vast majority of people are not going to be able to come up with anybody or come up with any experience. Even as a physician, I could think of one patient, over 20 years ago that I knew died from flu. And when we say 40,000 flu deaths a year, that's a lot of folks, but still the majority of people are just never going to encounter someone who has actually died from flu. Pretty much everybody today knows someone who died from COVID. I mean, across the board. And, flu has never been like this. With the 500,000 deaths we had from, late March to, well, actually, now we're up to close to, I think it's 560,000 deaths, which is just mind-boggling. And just to put that in some perspective, 4 years of World War II, we had around 400,000 American soldiers die over 4 years. So we have had more people die from COVID in 1 year than we had die in 4 years during World War II. And I know, and some of it's become so routine that we just don't think about it. We have this just natural knack to just fall into our routines and kind of put things off. But COVID has been horrendous, and it's not been a simple flu. A simple flu, again, is around 40,000 people a year. This is, like I said, 560,000 in a year. And hopefully we're never going to see anything about it or anything like it again. But one thing to keep in mind is that December and January, we were seeing horrendous numbers in the hospital. Just for Alabama itself, this time last year, there were about 350 to 400 people across the state were in the hospital. Well, December and January, we were close to 3,100 people. Some hospitals were, 60+% nothing but COVID patients at that time. And for the state of Alabama, just because our hospitals got so overwhelmed, the death rate just shot up. And when you're overstretching your hospital capacity, and you're overstretching the number of hospital workers you have, and overstretching supplies and those type of things, I mean, you see the death rates really take off. And fortunately, December, we started getting the first vaccines. Of course, they were aimed at the medical personnel and the nursing homes. But really, very quickly, after we started getting the vaccine coming out, now some of it too was there was a surge around Christmas time. Just so many people got together and spread it. But still, we just saw a tremendous rapid drop of hospitalized people. Even in the early stages of the vaccine coming out, that it's made a huge difference, especially going after the most vulnerable people. At the moment, we're probably somewhere around 15 to 20% of people in Alabama have been vaccinated. The numbers are now down around 350, a day in the hospital. So we've come down ninefold.
But it's still a serious situation. That
it is
we've kind of gone through the cycle here. I remember back, and our viewers will remember back when we first started hearing about COVID and this pandemic first started to hit. For a couple of months in, we talk about it and question, well, do you know anyone that's had it? And
right.
Most of us wouldn't know of anyone.
Right.
And then we started learning of people that got COVID. And then so many of us had loved ones that lost their lives to COVID. And as you said, the hospitalization numbers just went up dramatically towards the end of the year and into the first of this year. But most of us right now feel like there's a silver lining out there, that these vaccines provide a silver lining. Is it right to feel that way, Dr. Gazzini?
It's right to feel that way, but we still have to be patient. Just because we have the vaccine doesn't mean it's over. The vaccine's got to get distributed. People have got to be taking the vaccine. And And while there's a silver lining, um, you know, COVID is going to continue to throw curveballs at us. Yeah, there's areas of the country that are not doing as well as we are here. You get up into the Northeast, especially Michigan, and all of a sudden they're having a resurge. And what's a little bit scary is with these new variants, and some of these new variants are more aggressive than the COVID that's already been out there. But these new variants are hitting some younger people much more aggressively. In the state of Michigan, in the past month, there has been an 800% increase in hospitalizations with people between the ages of 40 and 50. And so all along we've been, told this is just an elderly person's, disease. But now that age range has dropped down a significant chunk, and it's has the potential of affecting a much wider range of people seriously. And so this is one of those curveballs, and so we cannot let our guards down at this point, because it is going to come back to bite us. Europe is in a horrendous situation. Europe is on the verge of lockdowns again, and it's because the hospitalization's going up with these new strains, and their intensive care units, especially France, the intensive care units are filled up with patients, and the physicians that work in the hospitals there are begging for another shutdown just to get control of the situation.
Wow.
Yeah.
So a lot of caution. So let's start here. Give us an overview on the vaccines that are out there, and where we are as far as the population base that has received the vaccine and should receive it going forward.
Right. Yeah. Obviously, they jumped on the medical personnel and the nursing home people initially, which was brilliant and extremely important to do. And that's why we saw our hospitalization rate drop so rapidly. Technically, it's open to 55, years of age and older. And then there's several categories of people that
just to interrupt you for a second, since we do have some viewers outside of the state of Alabama. I think what you're talking about right now is specific to the state of Alabama. Is that correct?
It is, but it's pretty close to the other states. The other states, follow suit. It's interesting. Alabama opened it up just recently to teachers, K through 12, and college professors, where Georgia opened it up for K through 12 teachers, but they didn't open it up for college professors. So there's a few nuanced differences between the states, but most of them are going to be very similar to each other. But currently we've got 3 available vaccines. The Pfizer came out initially, and it's a 2-shot vaccine, 3 weeks apart. Then Moderna came out, 2 shots, 4 weeks apart. And now we have the Johnson & Johnson vaccine, which is just a single vaccine. One thing with the Pfizer and the Moderna, it has what we call 95% efficacy against the virus. And so what that means is 95% of people who take the vaccine are never going to show, any significant symptoms of the virus. 5% will, still go on and have like a bad cold, type symptoms with it. But the good thing about these vaccines is they keep you out of the intensive care unit. You may still get sick, but we're not seeing people get sick enough that they progress on to the intensive care unit. The Johnson & Johnson is more like 85%, but still it works just as well at keeping you out of the intensive care unit. And so these vaccines are just fabulous for what they do there. Now we've got some of these new strains popping up. And so instead of 95% efficacy. We're down to 90% efficacy, but they still, of keeping you from getting like the severe cold and that type of thing. But they still keep you out of the intensive care unit, which is what we want to see keep happening. And and so fortunately, we don't have a variant that is found a significant workaround the vaccine yet. Yeah.
So, Dr. Gazzini, let's try to give our viewers an idea of what we can expect going forward. I had a guest a few weeks back who was in a state up in the Midwest where she was really having difficulty getting her children back into school. We know that schools still are doing remote teaching in a number of states. I think I read an article that said at least one of the vaccines this morning was announced as safe for children. What should we expect? Will most kids be back in schools come next fall?
I would suspect that by the time we get around through the summer, the vaccine is going to be opened wide. I would anticipate with younger people ending up in the hospitals, like we're seeing in increased numbers, that they're going to be a little quicker to open the vaccine up to everybody there. Fortunately, your K through 12 schools, most of them have done a really good job as far as protecting the kids. The kids wear their mask and keeping the kids in a good, safe environment. K through 12, they go from there, and most of them go home where the parents keep them in a good environment. And so the K through 12 range has been quite good. Now, what'll be interesting to see is what they do with sports. There's been some bigger outbreaks in some of the schools up in the Northeast, and a lot of it is sports related, practice related up there. And so, sports next year, unless there's a wide adoption of the vaccine, that may still be slowed down some, just for the student safety next year.
So if over the summer many of the school age K through 12 age, and I think the additional question as to what age it's safe to get the vaccine, as more younger people get the vaccine, still need to be cautious, but we should see a sign of things returning to normal. What about that age level, Dr. Gazzini? Is it 16 above at this point for the vaccine?
Well, that we're just going to have to still wait on the CDC guidance. They really haven't issued a whole lot of guidance for people under 55 there, but they will be they'll be doing so. But like I said, I anticipate that that they're just going to open it up for everybody. Yeah, how young the kids will be, it just depends on how young the companies are doing in their testing with it. As far as if they're testing 15-year-olds, they'll bring it down, to age 15. I haven't seen specifics on individual companies and how young they're going with it, but obviously they want to open it up to as many people as possible. So I would be shocked if they're not doing a significant number of studies and kids down to age 12 at this point. Yeah. Great.
I would encourage our viewers. Dr. Gazzini does a great job on his Facebook page of kind of keeping us updated on the vaccine and COVID and where we are with this. So you may want to follow him on Facebook for those updates. I also try to share those onto my page when they come out, because he provides some great information. So you mentioned sporting events, but you mentioned sporting events as far as our kids participating in sporting events.
Right.
What do you expect when we see college football starting up in the fall, or even Major League Baseball, which is starting up this week, will we see fans back in the stadiums? Will we see full stadiums again?
One thing to kind of keep in mind is when the safest places to be is outside. Outside, there's a greater amount of air to dilute down these droplets and the virus. There's often a breeze that's pulling these droplets away and moving them away from people and such. And so outside, as opposed to being inside, is far, far safer as far as not spreading COVID. Some of this, Brad, unfortunately, we're just going to have to kind of wait and see how the summer pans out, because if we get any more of these variants popping up that are more aggressive, boy, that can turn plans around 180 degrees. I mean, you and I remember too well watching the NBA make the announcement they were canceling the season last year. 48 hours before
that day.
Yeah, 48 hours before that, nobody had a clue, and then boom, it just instantly shut down. But I'm hoping that, again, if we can get enough people vaccinated, and keeping things outdoors, it'll be interesting to see if they start trying to limit the number of people, somewhat, if they're, trying to go for 60% attendance or something of that nature. They could do that. I know this past year they were, entertaining the 10 or 20%, and it was hard to choose and pick on that one. But I've got my fingers crossed that by the fall, hopefully we'll be able to do that. But again, that can all change so quickly. The local, Little League baseball or just baseball in general, I have not heard specifically what their plans are. Everybody's itching to do it, and I would be surprised if they don't do something with helping people be able to get out and watch again.
Well, as you well know, Larry, I'm a big Chicago Cubs fan and have been all my life. And I know at Wrigley Field, there's been an announcement that they will let fans in. It will be in limited capacity. I think they're at a 25 or 30% figure. But last year, we had nobody in the stands for Major League Baseball. So we're at least seeing things move in the right direction. But folks, and I know what Dr. Gazzini agrees with me, part of it is going to be all of us being responsible. Get the vaccine, wear your mask, practice social distancing. The more we do these things, the sooner things are going to return to normal. And if we don't do these things, we're going to continue to have problems. Is that fair to say, Dr. Gazzini?
That is very fair to say. People, back around a year ago, when people started first hearing the word herd immunity, it was like everybody became an expert epidemiologist overnight, and everybody was expecting herd immunity to be over, and have this taken care of in just a few months. The 1918 flu was 1918, 1919, and 1920. And the greatest majority of people died in 1920. And so this idea that herd immunity can just happen at the snap of our fingers is just so inaccurate. It's very wishful and hopeful, but it's just not accurate. Let me mention this. A lot of people, I still have people ask me today, well, Sweden just let everything happen and they're over it. Well, that's not true at all. Sweden had a far higher death rate than the countries surrounding it. And things got so bad in Sweden. Sweden eventually started passing mask mandates and had some shutdowns themselves. And so Sweden didn't just let it all happen and it was over in a couple of months. Sweden got into much worse trouble than its neighbors and eventually started following a lot of the same policies its neighbors were. And so So this just does not go away at the snap of our fingers. But it's still hopeful. We're moving in the right direction. And, obviously, a few times I've had to go in and help out the hospitalists that are in the hospital. They were just stretched. They were stretched. And so I've had an opportunity to go in and work and just work beside them there. And it's a situation that we just do not want to see it get that way again. It's happening in Europe, so you can't say it won't happen again because we're seeing it happening in other countries. But if we stick to the program and do the vaccines, we're going to do well. Let me mention this about Europe. One of the biggest problems Europe has is Europe does not have as easy access to the vaccine. And so while we're in the kind of the 18% range of people being vaccinated, they're probably 5% or less. Now, England is doing well. England has been able to secure its own supplies of vaccine. And so England has seen a dramatic drop. But your countries like France, Italy, Germany, and such are hurting right now. Again, especially France. And so we just can't let our guard down on this. No.
I want to talk about travel, international travel, but before I do that, you mentioned the time you spent helping out in the hospital. I just wanted to give a huge thanks to you and all of the other people in the medical community for the tremendous efforts that you've made and are making throughout the last year. I've heard stories about things going on in emergency rooms and in COVID units and the exhaustion that's out there. Y'all have certainly become my heroes and a lot of our heroes over the last year. So thank you for what you're doing. But I also want to say, oh, don't be humble. You're a hero. What I want to say here, folks, is Dr. Gazzini just made a great point. It seems like everybody became an expert over the last year. If you want good information on what's going on with COVID and with these vaccines and how things are going to move forward, your high school graduate friend on Facebook isn't, automatically an expert on this. There are plenty of good resources. This episode, this Facebook Live episode, if you know somebody that could benefit from what Dr. Gazzini is sharing here, refer folks back. This Facebook Live episode will live on our Facebook pages. It will be on our website at Bound & Bodas. If you think people would benefit from what Dr. Gazzini is saying today, and certainly he knows more about this than many people out there, refer them back to this episode for further information. Dr. Gazzini, you mentioned travel. It seems like domestic travel is getting back to somewhat normal. We're seeing people flying domestically. What about international travel? Is it safe? When will it be safe? What should we expect?
Well, we're going to have to see when, especially if, travel to South America or Europe is not a good thing to consider at the moment. When you travel, you want to enjoy places, you want to enjoy the food, and right now you're not guaranteed the restaurants are going to be open, or the places that you want to visit are going to, have access to them right now. And so, planning a trip for the next 2 to 3 months overseas is probably not a good idea. And it will probably fall through anyway. Again, especially when we see these numbers and going the direction they are. One thing for domestic travel is picking up. Now, I know a lot of people are getting excited about mask mandates being dropped. One thing to realize is when you go to airports are under federal law. They're not under state laws. And so, you can't get the idea that you can go to the airport without a mask to travel somewhere, because the federal law is going to continue to encourage the use of the mask. and such. I just traveled this past week, went to Texas to see my grandson and see my son and his family. Texas did away with the mask mandate a few weeks ago. I couldn't tell that the mask mandate had gone away. Businesses were still requiring the mask. So I've talked with somebody today who was all excited about not having to wear a mask anymore. And I think I burst her bubble there because, businesses will still require masks and such. And so even though there's not a mandatory state mask mandate, it's still going to be out there. And it needs to still be out there as we're seeing. I mean, as long as we're seeing states that are ramping up in cases, we need to be diligent. We are getting close, and I know we hate hearing that word close, but gosh, prior to the vaccine, I mean, this was going to go on another 2 years. But with the vaccine, hopefully, come this fall, we'll be at a point where we might be able to go certain places without a mask. But again, anywhere we go that's enclosed and doesn't have real good ventilation, and we're around other people, we need masks. If we're somewhere.
I want to ask a real important question, and I want our viewers to pay attention to this. So, our viewers know that I've had COVID. I fortunately had a very mild case, and I've recovered. And I hope to have the vaccine soon. So, if I have had COVID or if I get vaccinated, why do I need to wear a mask? Tell us why that's still necessary.
Great question. Now, one part, there's still a learning curve with COVID. That's one of the things that's frustrated people. At first the CDC said no mask, then we needed mask. Well, we started going to masks because we found masks actually did help. It wasn't appreciated early on, but it was appreciated soon afterwards. And so, part of this is being very cautious, especially if we're in a crowd of people. If we're in a crowd and we come into contact with somebody that has COVID, and we breathe it in, and our respiratory system is holding it, and then we mill around and we move somewhere else and we're talking to someone else, and then we're breathing it back out. Even though we won't get sick from the COVID, there's still a concern that people will still have the ability to transfer the virus around to someone else. The CDC is putting out some guidance. If you're in a group of people where everybody has had the vaccine, then you don't have to wear the mask. If you're going to a household, and of all the people there, if there's one person who has not had the vaccine or had COVID, then everybody's okay to do without the mask. But as soon as you get more than one person in a room that's not had the vaccine, and you're grouping together, you need the mask on at that point in time.
So we're not wearing the mask if I've had COVID or if I've had the vaccine. I'm not necessarily wearing it for my own safety, but for the safety of the people around me and my loved ones.
Exactly. The mask itself has mainly been for other people. A lot of people, scoff at masks because they say, well, the virus is smaller than the pores of a mask. Well, the virus travels on droplets. The way a virus gets around is it has to have something to carry it. And so that means that a virus gets around is on these droplets. And so the droplets not only help a virus get around, the droplets are a place the viruses concentrate. So when we're breathing out, probably 99+% of the virus is on droplets. And so the masks do an excellent job of catching those droplets. The cloth ones do well. These paper ones actually even do a little bit better. These are matted as opposed to woven. And so the pore size on this is actually a little bit smaller. and it's impressive how well they worked. Brad, you were the one who introduced me to the YouTube video of, I think it's Uncle Rob or Uncle Bob, who used an aerosol can to demonstrate how well these masks actually stop the droplets and such.
I should have remembered a link to that video. I'll make sure to put it on our Facebook page, because that is a great video that demonstrates how effective the mask can be.
Yeah, and it's a self-proclaimed redneck who came up with an ingenious, way of showing just how well masks work. And so, yeah, the guy is sharp. I was about to say you don't have to be a rocket scientist to figure it out, but yeah, it was ingenious.
So you just mentioned an important thing. If you're in a home or in a room with people that have largely been vaccinated, I think you said everybody but one, then it should be safe, because I think that's important to a lot of people that have loved ones that have been in senior care facilities or nursing homes and have been unable to see their loved ones.
Yes.
What's your guidance going forward? Can we now spend time with our loved ones, with seniors that we've been staying away from over the last year?
Yeah, I think we're going to see a lot of the different facilities are going to come up with their own rules and regulations for that. But if someone's in any kind of senior living facility, they've probably had their vaccine, in all likelihood. And then if you've had your vaccine, that should make that happen. I've seen reports, where people are getting together with families for the first time, in a year. And so hopefully as more and more people get their vaccines, we're going to see that happen, because they are some of the hardest hit victims as far as just being separated from their families that are out there. One of my partners, his mom turned 100, during this time. And so, the best they could do was stand outside her window and let 100 balloons go, for her, and do that kind of thing. But that has just been awful. Those poor people being separated from family to that degree. But that's one of the beauties of the vaccine, is it's going to allow people to families to get back together.
Yeah, I've heard so many stories. Basketball fans that have been watching the NCAA tournament over the last couple of weeks are familiar with the story of UCLA coach's dad. He hadn't been able to see his dad for the last year, but his dad has been able to travel to the tournament. He's been vaccinated, and they're able to see each other at least from a distance. I think that had to do a lot with the NCAA protocols that the coach was having to follow. But being able to be together with family members. Heck, I haven't seen my mom personally in over a year now. It's great. I won't be able to join them, but a number of my family members are going to get together for Easter up in Wisconsin. They've all been vaccinated. And, it's just great that we're going to be able to have that type of togetherness again. It's interesting, though. I think some things have changed forever. I think we will be doing a whole lot more video conferencing, like you and I are here today. Heck, you and I probably, neither of us knew a year ago what Facebook Live was, or
Zoom. Never heard of Zoom. But one of the things that's going to be interesting on down the road is even when we have like a really, bad flu outbreak going on, I think we're going to see people wearing masks. One thing that was just impressive when we did the lockdown a year ago, flu was in full swing, but I mean, almost instantly overnight, when they shut everything down and with the distancing, we saw flu just come to a very abrupt halt. And then even though things have opened up because we've got the mask, flu has just been a rarity this year. We had our own little separate sick clinic that we were seeing patients in when we were testing for COVID. But anytime we tested somebody for COVID, we also tested for flu. I never saw a positive flu test. I probably saw, 50, 60, positive COVID tests over the time, but never saw a single positive flu test. And so that's just a tribute to the masks.
Yeah, I've shared on these episodes in the past. It was just over a year ago, the last time I traveled, and I remember going through an airport February of 2020 and seeing somebody in the airport that was wearing a mask, and I thought to myself, boy, that's strange. But now we all are, and many of us will going forward. I've heard a number of people that have had bad seasonal allergies say, hey, I'm going to continue to wear this mask because it's protected me. I haven't suffered from those allergies as bad as in past years.
Right. One thing just to say real quickly about the mask do not limit the amount of oxygen we're breathing in. Okay, some people worry about that. Now you're breathing through a little bit more resistance, and so so you have to work the lungs a little stronger, but it's not limiting the oxygen flow, nor does it trap the carbon dioxide. A lot of people try to say, oh, you're just trapping carbon dioxide in there. No, it doesn't do that. There's been studies. The most accurate way of determining carbon dioxide levels in the bloodstream is to do something called an arterial blood gas, where they stick you in an artery, to draw the blood out, and they measure the oxygen and carbon dioxide levels. And so there's been some, I guess you can get a medical student to do about anything sometimes, but they've done studies with medical students where they put the mask on and keep them on for a certain length of time, go back and do these arterial blood sticks before and after, and it makes no difference. Also, some people try to say mask trap the germs and you're more likely to get sick that way. That is just bogus. And all my years of medicine and being around surgeons and anesthesiologists, I've never met one who said he got sick from wearing his or her mask there. And so I just mentioned that because there's a lot of misunderstanding on masks in that direction.
Yeah, it's unfortunate. These are the issues you and I discussed way back in August about the myths related to mask wearing. There are many myths still out there, but folks, it just makes perfect sense. If you're around other people, if there are people that are at risk of getting COVID, be careful. Yeah. Dr. Gazzini, I want to talk about the vaccine process now directly. So, speaking of myths, question I have. So I have had COVID and I've recovered. I've heard people say, well, you need to wait a number of months after recovering from COVID before you get your vaccine. Is that accurate?
Yeah, it's it's not etched in stone necessarily. Some of it is people that have had COVID, because of the illness, they've got some antibodies in their system. They've got some ability to now fight this virus. We knew the vaccine rollout was going to be kind of a slow rollout. And so in order to get the vaccine to the people that needed it, it was important to get it to the people who haven't had it, who have zero antibodies, in their system.
Right.
And so some of it was a delay that was necessary just to give people with no antibodies a chance to develop antibodies. We generally say 3 months, and so people are probably covered pretty well. The frustration is there are some people who do come down with COVID more than one time. And then again, with these variants popping up, some people are going to be a little more susceptible to these things. And so if people have had COVID, they certainly need to get at least one vaccine, ideally two. If you've had COVID and when you take the vaccine, you are a little more likely to have some reaction, meaning some body aches, low-grade fever, just feeling tired. You're a little more likely to have that. Some people who've had COVID get the vaccine, nothing. But if people have a pretty dramatic response, I had one person who, ran a 101 fever for 2 days and was just wiped out. He probably doesn't really need to take the second vaccine. His body has mounted a very vigorous response to it, but if you tolerate the first vaccine, it's important to get the second vaccine. Yeah.
All right. As far as actually getting the vaccine, a lot of people under the age of 65 and till recently now 55, having a very difficult time. And I'm sorry, people that were within the qualified groups, over 65, now just over 55 in Alabama to qualify, having a hard time finding a place to get the vaccine. What's your understanding about the availability of vaccines and where people can get them going forward?
Right. Now, all the vaccine is distributed through, through the health department. Now, what's interesting is there's state programs and federal programs. Some of your Walmarts and CVS's are actually through a federal program, and so that comes in a little differently. Whereas any physician's office gets and such is all coming through the state, and so the state then depends on the CDC, and so sometimes it's hard to anticipate. Like in a doctor's office, how much vaccine we're going to be getting. Our office, we got our first batches of vaccine just this past week. The health department did a walkthrough in our office over 4 months ago. Said yes, we're going to send you 3,000 doses. You're number 50 on the list, and then we didn't hear anything. And then they eventually said, "Don't call us, we'll call you." But some of it was that their hands were tied in their ability to procure it from the CDC. But it has certainly opened up much more widely. Locally in Birmingham, the UAB has been a main distributor and has done an excellent job with it. Some of these walk-in clinics were able to get it earlier on and have been doing it. Now the Walmarts and CVS's have it, and so it's going to get easier. But one thing that's been an interesting trend is that the more rural the area was, it seemed the easier it was to get the vaccine. It was very difficult for me to help my mom, who's 90, get the vaccine. Eventually, we stayed up till midnight one night and got on the Walmart website. And Walmart opens up 1 week out. So at midnight, they open up for appointments 1 week out. And so we had to get on at midnight, and found her a place. I've got patients who've been traveling all over the state, going to these little cities and towns that you've never heard of because the rural areas tended to have a much easier access. I've got a aunt and uncle that live in Camp Hill, Alabama, which is about, 25 miles outside of Auburn. You literally get on 2 different dirt county roads to get to their house. I mean, it's far out. When I asked my uncle if he'd had the vaccine, he said, sure. He said, somebody told us the armory down the highways got it, and no appointment. They just drove in there and got it. And so the distribution on this has been an impossible thing to figure out.
But Dr. Gazzini just said something important for our viewers. If you're in the Birmingham area, internal medicine specialists now have vaccine, and you've told me that it's okay to say even if you're not a patient there.
Yes, if you're not, as long as we have supplies, we will vaccinate as many people as we can. And so, so 205-877-2761.
We've put that number up, and I will say, in addition to a good place to get the vaccine right now, just a great group of doctors
Right.
Great staff. If you're looking for a physician, you're in the Birmingham area, you can't do better than Larry's practice. They do a great job. So I encourage you, if you're looking for a physician, to reach out to internal medicine.
Okay.
So I want to just take a quick break here and remind our viewers. My name's Brad Bodis. I'm with the Bond & Bodis Law Offices. We're in Alabama, Mississippi, and the Knoxville area of Tennessee. We help people with money problems. If you're having financial challenges right now, and so many people are, please don't hesitate to reach out to us. We're offering absolutely free initial consultations. We will do them from the comfort and safety of your own home or office. Like, I've been doing it for over 30 years, folks. I've been helping people with bankruptcy challenges. This is the first time ever you can do the entire bankruptcy process from start to finish, including your court appearances from home or from your office. Everything is being done virtually right now. So if you need help, reach out. We'll do a free initial consultation with an experienced attorney, and we'll talk to you about what options exist. Dr. Gazzini, we're getting close to an hour here. We've probably got another 10 minutes or so. I want to be respectful of your time, but we have had some questions coming in here. And I want to give you a chance to address a couple of these. So I have a question here, and I think this is a common one. This person says, I don't want to get the vaccine. We don't know what's in it. Why should I care or go to the trouble of getting vaccinated?
All right. Well, first off, if you want to help make 2021 be worse than 2020, then you avoid the vaccine. As I mentioned before, the flu of 1918, went all the way into 1920, and 1920 had a much higher death rate than the year 1918 did. And so these things just don't go away that quickly. As far as what's in the vaccine, we know everything that's in the vaccine. There's not any hidden ingredients in the vaccine. Occasionally, I still get asked this. It is just one of those myths that just won't go away completely. People ask me if is there a chip in the vaccine, and the answer to that is a resounding no. Bill Gates is not putting a chip inside the vaccine. Your cell phone carries far more information about you and tracking information about you than you could ever put in a microscopic chip. And so it's, so we don't have those kind of foreign bodies in the chips. One thing too, that
some new vaccine they just rushed through. I know you've written to this. It's not that the science here is not absolutely new science, correct?
No, it's not new science. Going back in the early 2000s, there was an outbreak of SARS, which is the family that COVID is in. Now, that particular SARS, unfortunately, it did not spread as easily as COVID does, or, COVID's a lot of times called SARS-2. But fortunately, that SARS did not spread as easily as the current one does. But that one was far more deadly. And so back in the early 2000s, there was some preliminary work done on a small scale of starting to work on a vaccine. The frustration was by 2012, there were no recurrences. And so the work on those vaccines came to a halt because the funding came to a halt. But it at least provided a springboard of information that we use to make our current vaccines for SARS-2. The technology for this, for our COVID vaccines has been in the works for a long time. This provided us an opportunity to jump on it and use it because we got a new disease. And so they jumped to this new technology, which uses just a smidgen of the virus's RNA. Your old-fashioned vaccines, you're getting the whole virus, the RNA and everything in these inactivated viruses. What you get out of these new vaccines is a very tiny fraction of what you would normally get with a vaccine, but it's very, very targeted, and again, it works extremely well. When we say it's been well studied, or people say it hasn't been studied, I mean, how many patients in a study is a good study? And generally, the FDA wants somewhere around a little over like 10,000 patients in a study. And so in the past, a really big, say you got a new cardiovascular drug coming out, a big study would be 18,000 patients in that study. Well, each of these viruses has had 40,000 patients in the studies. Each vaccine. Yeah. So we're talking over 120,000 people in the studies. And so the sheer number of this is just amazing, and far greater than typical things. And so there are tons of people who've taken all kinds of medications that have been studied in a fraction of the number of people than we have with these vaccines. And so the overall safety on these and the sheer number of people that it's been given to is very significant. Yeah.
So it's a safe vaccine. It's well tested, and we all need to get vaccinated to keep this from being with us for another year or two. Exactly. Question I have from another person is, will we see something like this again? When we get through this incident, this experience, will we have another pandemic in the future?
Yeah, a great question. Of course, the answer is we sure hope not. But pandemics have been happening for as long as mankind has been around. Some of the most famous ones was the plague, back in around the 1300s or so. That was a devastating thing. For us, the most in recent years, the thing that was closest to this was the flu of 1918. Now, the flu of 1918 was even worse than this. I think the flu of 1918 helped bring World War I to an abrupt end because of just the sheer number of deaths that occurred in the European area there, and such. But there's going to be different degrees of pandemics pop up, and the flu is always going to be that one that has a lot of potential to give us trouble. But now we've got, this is the third version of coronavirus that's popped up. There was the SARS one, and then there was one called MERS for Middle Eastern Respiratory Syndrome. Now that one was really nasty. The first SARS would kill about 5% of people. The Middle Eastern killed about 25% of people, that came in contact with it. But fortunately, it was in a very small geographic location. But these things, of course, Ebola, pops up in Africa from time to time, and we had our own scare to be careful with it here, and such. And so, so pandemics are going to continue to happen.
Dr. Gazzini, we're just about at the end here, but I do have one important question here from a viewer. Dr. Gazzini must have a fan club. This viewer wants to know if you're taking new patients.
Okay. Oh, yes, we are. Yes, we are taking new patients, certainly.
All right. And they can contact you with the information that's been on our screen here.
Yes.
I can vouch for Larry and his practice folks that they do a great job, and they're concerned about their patients. They show great empathy and great skill. It's not somewhere where you run in and out. They take care of their patients. And Dr. Gazzini is one of the best. So we're at the hour here, and to our viewers, I think I can summarize what Dr. Gazzini has said by, we do see a silver lining. Thank God we are we're in a much better place with respect to COVID than we were 6-8 months ago. Certainly, even just a few months ago, first of the year, and the vaccines are out there. And more people are now able to get the vaccines. Heck, you can now get them at internal medicine specialists, at Dr. Gazzini's practice in Birmingham, Alabama. So reach out. It's important. These vaccines are safe. Get vaccinated. Continue to social distance. If you're with somebody that hasn't had the vaccine or hasn't had COVID and is still at risk, wear your masks. Just be smart and let's take care of one another.
Yes.
If you know somebody that can benefit from the great advice that Dr. Gazzini shared today, please refer them back to our Facebook page or to our firm's website where this video will live. Dr. Gazzini, thank you so much to you and your practice for helping out and for sharing the information that you have. We really appreciate you.
Sure thing. Well, it's a pleasure to be here, Brad. All right.
Now, on behalf of Dr. Gazzini, on behalf of myself and all of us here at Bond and Botus, take care of yourselves. As we always try to say as we finish, faith, family, and finances. That's what we're about. We want to help you. We want to be available to you. And we'll continue with these Facebook Live events. We'll see you again next Wednesday at 1:00 p.m. Central Standard Time. Thank you, Dr. Gazzini.
All right. Good to see you, Brad.